Continuing Mobile Education for Emergency Medical Services Providers. Episode 2, Did You Take Your Pills Today? Evaluating Medication Compliance. You will learn the epidemiology of medication noncompliance. You will identify obstacles to medication compliance, and you will learn practical strategies to assess medication compliance.
I would say the majority of patients that I encounter, as well as really what the literature reports, is that most patients don't take medications as prescribed. And this really becomes a concern, particularly when we think about cognitive impairment. Individuals may have early signs of dementia, that they, even with the best intention of taking all the prescribed medications, there may be problems with them remembering. And the simple pill-taking strategies that may work for most patients may not work as well for them. So I'd say the majority of patients are not taking medications as appropriately prescribed, and that certainly has an implication with regards to complications that can occur for the patient down the road.
I think it happens fairly often. I think people tend to look for the easy way out. So if they have something that they have to take 3 times a day, well, maybe they'll take all 3 at once. I don't think a lot of people really understand that some of this stuff needs to be spread out. I definitely think that people look for the easy way out on things.
I think the biggest obstacles, first of all, is just the large number of medications. So this gets back to the point of polypharmacy. I think as the number of medications increase, really the difficulty in patients taking them, particularly if they're on complex regimens of multiple times a day, really becomes a challenge. I think the other issue is that oftentimes patients don't understand necessarily why a particular medication is prescribed for what condition, and sometimes that disconnect between the knowledge of why a medication is prescribed and why the patient's taking it oftentimes can affect the compliance in terms of the pill-taking strategies that they have. And I think the final issue I always get concerned about is really just for those that are developing memory impairment, because it's simply just challenging to remember, even with the best intentions of using pill boxes and timers and calendars. Those begin to gradually kind of fall apart as a strategy as a person's memory or their cognitive disorder can worsen over time. So that's certainly a concern.
Obstacles to medication compliance include the large number of medications that become challenging to take correctly. Patients may not understand why a medication is needed, and they may suffer from memory or physical disability, which adversely affect medication compliance.
I think there's a lot. I think that people get depressed. I think when they're depressed, they tend not to take their medications as they should. I see it often in significant others. When one passes, the other gets real depressed and doesn't want to take their meds. I think things are expensive. This is America, and it's in the age for the corporation and not the consumer, so we know that cost is definitely an issue why people don't take their medications. I think that some people have difficulty taking meds. I look at the older patient who has congestive heart disease, and they have to take potassium supplements every day. And these pills are the size of my thumb. And I can't imagine myself being a young, healthy person trying to get one of these down, yet alone somebody who's older. I think some of the frequency of things, I look at medications, say for Parkinson's, where people are taking their Sinemet 3 to 4 to 5 times a day. Having to be able to take that every couple hours can definitely cause a reason for people to be non-compliant. And the older we get, the more we tend to forget. I think whoever comes up with the ultimate and reminder system will become quite the wealthy person.
Other obstacles to compliance include psychiatric conditions such as depression. Patients may not be able to get their medications because of financial or logistical reasons. Physical difficulty in taking the medication and dosing frequency also contribute.
When addressing medication compliance, it's a challenge since usually the pre-hospital provider has an advantage, because I think most patients don't like admitting to a doctor that they don't take their medications regularly all the time. They might be more apt to acknowledge to the pre-hospital care provider, oh yeah, well I kind of forgot to take that today, just don't tell my doctor because he'll be angry at me again. And so again, if the pre-hospital provider asks that, the other thing is if I know what those dosage regimens are, if I look at the bottle and I see BID, meaning twice a day, then I know that they probably took it in the morning and the evening. And if it's lunchtime, then I need to ask them, did you take your hydrochlorothiazide this morning? And that can help identify things for me as well. Obviously, the other one is looking at the number of pills that's in that bottle. If the fill date was a month ago, it's a 30-day supply, and the bottle's still full, then they're non-compliant with their medications. And since sometimes those medications don't get to the hospital, that's going to be very, very valuable information.
I think this again is a situation in which EMS personnel really play a critical role in evaluating compliance with medications, because just simply by assessing the home environment, seeing that if there's empty pill boxes or pill bottles around, you can get a sense about what the patient's taking. If you're evaluating a patient early in the week in their house and they have a completely empty pill box from the following week, that certainly argues very strongly that the patient is not taking the medications appropriately. Just evaluating the pill bottles themselves and seeing when there's a refill, when the refill's due or when it was last refilled. Full pill bottles that have not been taken certainly are informative about the pill taking strategy the patient has used, as well as empty bottles that may be inappropriately empty far before the refill date is due, and that's particularly concerned about medications we're concerned about toxicity or even an overdose situation. So really just a quick assessment about how full or how empty pill bottles are, and whether or not there's a presence of a pill box, and does it correspond to the day of the week that the patient's being evaluated. And that's a very kind of quick assessment that can be made, but tremendously valuable to really pass on to the care team down the road.
To evaluate medication compliance, ask the patient, be specific about dosing, look at the number of pills remaining in the vial, and look for other strategies, such as a pill box.
One can do a better job determining medication compliance by looking at how many pills have been used in that pill bottle since the last fill date, asking them when they've taken their last dose, and particularly for medications that are twice a day or 3 times a day dosing, ask them if they took it earlier this morning, and simply just asking the question. It's not sufficient, do you take your atenolol? It's, did you take your atenolol this morning, as an indicator of compliance.
After watching this episode, you should know the epidemiology of medication noncompliance. You should identify obstacles to medication compliance and learn practical strategies to assess medication compliance.